Hi, everybody. My name is Jake Berkowitz. I'm a fourth-year medical student at Kirk-Kerkorian School of Medicine at UNLV. This is my virtual presentation for this case report, which is vascularized pedicle fibula flap with split periosteal overlay for ankle arthrodesis, modifications of technique, and case report. So this was a 52-year-old woman who had had a history of myelodysplastic syndrome that was then treated with a stem cell transplant, and she was maintained on an immunosuppressant called sirolimus. And about 15 months after the transplant, she started to have really bad pain and swelling of her left ankle. She went to a podiatrist who then referred her to an orthopedist who then referred her to a plastic surgeon. And they did a CT, and that figure is down in 1C. And that large arrow-headed shaped kind of defect in the distal tibia was osteonecrosis. Now, the problem with her is that this is a pretty big defect. And so typically, distal tibial lesions can be treated with ankle replacements, ankle arthrodeses to make a new joint. But this is a lot of bone stock that would be lost after it was all excised, which would typically not really result in a good postoperative outcome. So the surgeons here opted for a kind of more novel technique. Essentially, what was done was the necrotic tibia from the distal part of the left limb was removed. They created a recipient site there to allow for the ipsilateral fibula, so the fibula on the same side, to essentially be slotted into place. The tibia is the weight-bearing bone of the lower leg. The fibula is really just there for support. So what they did was they took the fibula from the same side, still attached to all the peroneal vessels, and they essentially just brought it over, slotted it in place. That's kind of what figure 2 is showing, is the post-op 3D CT. So if you can see it, it essentially is just a piece of fibula kind of slotted into where that tibial segment had been and then pinned in place with screws. And what this resulted in was a really, really positive postoperative outcome for this patient. 3 weeks post-op, she wasn't taking any more pain meds. 8 weeks post-op, she was in a short leg cast and was able to walk in a boot. 14 weeks post-op, she was able to ambulate and bear weight on that extremity. 8 months post-op showed successful union of the distal tibia to the fibula. And then kind of moving forward, 21 months post-op, she had complete radiographic union of the distal tibia to this fibula flap and full tibiotalar arthrodesis. And then just as just a general sort of what some of these terms might mean, because I didn't really go over that at the beginning, a flap is essentially just a graft that is bringing along its own blood supply. And a pedicled flap is one where it's at no point ever removed from that blood supply. So in this case, the donor fibula is harvested along with its vessels, is not removed from the vessel source, and it's essentially just put over and pinned in place. So this is really interesting because, again, this is somebody whose surgical course probably might have gone more towards amputation of the limb just because of the size of that defect. And instead, they were left with quite a good outcome, pretty much total use of that left foot. And so what the surgeons are able to find here is that this is a plausible sort of method of being able to deal with really serious, complex bone salvage situations such as this. Some drawbacks to the study. It has yet to be seen sort of how this method will hold up over the years. We would have to check back in with this patient, maybe in 5 years, 10 years, 15 years to see how this sort of thing holds up against a standard arthrodesis or a total ankle replacement. In addition, it's a pretty expensive way to do things. It's a complex procedure, but in general, just a cool sort of example of how medicine can kind of go a long way in improving someone's quality of life when they were kind of left with a pretty poor situation pre-op. Anyway, just special thanks to Dr. Goldman at UNLV and all the people that were involved with the surgery for allowing me to present this today. And thank you to the GPSA as well. Thank you, guys.